Good morning. Can everyone hear me? Thank you, David. Thanks, Denise. Let's see, what time is it? 10. Maybe we'll give it a few more seconds. Don't have very many people today. All right, I guess we might as well start. Good morning, everyone. I am Dr. Lindsay Nelson. Today we are going to be talking about andropause, not a commonly known term, but it refers to a man's decline in sex hormones as they age. Just as a female who goes through menopause, it's not as simple as just low estrogen levels. For men, we start to see a decline in hormone levels, and it's not as simple as just low testosterone. And so I thought it'd be an interesting subject matter, given that we just had Father's Day, and sometimes I don't talk enough about men. So I thought, let's talk about something that we see only with men, and it's called andropause. Andropause has been linked, or at least been a contributing factor to many diseases such as heart disease, stroke, diabetes, depression, suicide, Alzheimer's disease. And if you see that list, all those diseases are the top causes of mortality in the US. If you've been attending my lectures, you'll also know that they are tightly linked to inflammation. So we know that sex hormones have to have some sort of connection to keeping inflammation in check. Having low testosterone levels or low hormone levels can affect a man's quality of life as well. We see a lot of emotional changes, such as depression, lack of motivation, forgetfulness, or decrease in mental acuity, mood swings, maybe more sensitivity. Maybe men find that they're crying more, worrying more, low energy, sleep disturbances, insomnia. Those are all pretty common. We start to see physical changes, loss of muscle tone. Maybe men are working out and not keeping the same muscle tone as they used to. Changes in fat distribution, so more fat maybe in the lower, in the abdomen, or maybe even the pecs. It's called gynecomastia, or what most people call moobs, man boobs. You might even see galactorrhea, which is basically lactating breasts. We start to see shrinking of the testes, decreased libido, maybe erectile dysfunction, decreased body hair. Maybe men are talking about how they don't need to shave as much. They might have hot flushes, a little bit different than hot flashes. Loss of bone mass. Maybe men will be talking about shrinking in height, or getting low impact fractures. So very important, especially as we age. We know that the risk of like a hip fracture and that type of stuff greatly increases. We start to see chemical changes, blood sugar abnormalities. So I'm going to be looking for increase in glucose, increase in hemoglobin A1C, changes in insulin levels. Inflammation markers go up with andropause, such as CRP, so we want to look for that. Maybe elevated homocysteine levels. Homocysteine we know is a good indication of a heart attack risk. Maybe their blood pressure is going up, so we want to check that. We might see elevated cholesterol levels with andropause, so it's important to keep up on that and check those levels. And those things that I just mentioned are all kind of like secondary testing that I'm doing when I'm doing a workup for andropause. Might also check their thyroid levels, but most importantly, I am going to check their hormone levels. Hormone levels for men, it's not as simple as just testing their total testosterone. I firmly believe that testing your hormones via salivary testing, so saliva, is important. It's one of the easiest ways, and it's much more accurate than blood for many reasons. Women, their hormones fluctuate throughout the month. And for men, they actually fluctuate throughout the day. So they're high in the morning and low at night. So with salivary testing, they're taking multiple tests, they're taking multiple samples. And so we can kind of map out their testosterone throughout the day. We know exactly what their hormones are doing. Blood testing, also, the reference range is quite large. It's, depending on the lab, 120, something like that, to like 850. So it's a very wide range, and we're going to miss a lot of men who fall on the extreme ranges of normal. The other thing that people don't realize is that as far as testosterone, there's no governing body to regulate what's normal. And so what labs are doing is they are creating their own reference range. They're creating a bell curve, and that normal range is taken from a population of men under 40, healthy and non-obese. And so it's not really a good indication of what of all men that are coming in to look at their testosterone levels. And so I think it's important for those reasons specifically to look at salivary testing. It's also important to look at different forms of testosterone. So most of the testosterone in the blood is bound to two hormones, one being the sex hormone binding globulin, SHBG, and it's over 50% is bound to SHBG. And then it's also bound to albumin. It's tightly bound to the sex hormone binding globulin, so it's pretty much an inactive form. It's weakly bound to albumin, so it can easily disassociate from albumin and become free testosterone, which is your active form. Many times when men to go get their testosterone tested, they're getting their total testosterone, which is going to be free and the bound testosterone. And so it's not a good indication of what's more bioavailable or the active form. Approximately only 2% of testosterone is unbound, and that is considered the active form. So it's important to get your total testosterone and your free testosterone. Does that all make sense? I hope I'm not going too fast. That's also important to get your LH tested. Your LH is luteinizing hormone. It's released from your pituitary gland. So it acts on the testes to increase your testosterone levels, and it's important to see, if you have low LH, then you might have low testosterone. I think it's also important to test the sex hormone binding globulin, your SHBH. Some men have a lot of SHBG. It's also important to test your dihydrotestosterone, your DHT. That is a small amount of testosterone is converted into DHT. DHT is your most potent androgen. The other thing that I find the most important is that a small amount of your testosterone is converted into estradiol or estrogen by an enzyme called aromatase. Estrogen plays an important role for men in bone health, keeping their bones strong, cognitive function, memory, and your plasma lipid levels. So aromatase is present in fatty tissue. So some men who are overweight are going to be producing more aromatase, which means they're going to be producing more estradiol. A lot of men have symptoms of low testosterone, but when tested, actually just have high estradiol levels. Um, which also brings me to, it is important to consider estrogens in our environment, which are called xenoestrogens. Xenoestrogens can be found in non-organic hormone-fed meat and dairy. It's actually very common. We also find it in our plastics, especially those plastics that are heated up, so maybe zapping, last night's dinner for lunch, or, I frequently get Americano and an iced Americano in a plastic cup. That's not good. We can find, xenoestrogens in shampoos, air fresheners, weed killers, insecticides, red dyes, sunscreens, lotions. I think that was a lot of them. So I do find that to be a big deal because for a lot of men, those xenoestrogens are competing with testosterone. So again, they may be seeing symptoms of low testosterone, but it's really estrogen excess. And too much estrogen can lead to that inability to put on muscle, obesity, emotional changes, etc. Treatment can be varied. There's a lot of forms of testosterone replacement, shots, gels, lotions, sublinguals. It's usually only recommended for men who are actually having erectile dysfunction. The problem with giving testosterone is there's usually an increase, men feel good, but then that effects start to wear off and we have to keep increasing their testosterone levels. And we do know from history that too much testosterone can have some damaging effects on the liver. Men can get very aggressive, etc. We also lotions and that type of stuff, we have to be careful because that can rub off on our partners or our children or whatnot when we hug them. So, the form of testosterone is important. I don't typically give testosterone. If I do find that a man needs increase in testosterone, I'll usually do DHEA first. DHEA is a precursor to testosterone, so sometimes it just helps push them in the right direction. There are drugs that prevent testosterone from being converted into estrogen. Those are going to be aromatase inhibitors. We also can give, nice natural supplements that help bind up excess estrogen in the liver. Weight loss is going to be a big one. If we can decrease their fatty tissue, then we know they're going to have less aromatase, which means less conversion of testosterone to estrogen. There are many different forms. I think what's important though, and why I wanted to do this, is that I find so many men have symptoms of testosterone, low testosterone or hormonal changes, that they look like they're going through andropause, and they're going to get their blood tested and they're just getting a total testosterone and they're told that they're normal and they're sent on their merry way. And so I want the kind of the takeaway from this is just make sure that you're getting the full test done, and to know that changes, andropause, low testosterone, high estrogen can lead to other secondary changes like high blood sugar levels or high inflammatory markers like CRP. And so it's important to get all of those tested as well. I just think men need to get a full workup, and men are not always the quickest to go into the doctor and get those levels checked. So that is my lecture on andropause. You can find a copy of this, because I know I said a lot, on my website, drlindsaysnelson.com. As of now, though, do any of you have any questions that I can answer? I think you guys can unmute yourself, but if not, you can put it in the chat box and I can answer them. Anyone? I don't know how long to give you guys if you're trying to type in the chat box. Is there anything to take now to increase your testosterone levels? Is that the question? I would not take anything to increase your testosterone levels without knowing what your levels are first. I think hormones are finicky, and it's not something to play around with without knowing what your actual levels are. And I would say that to a woman too. I don't prescribe bioidentical hormones until we've checked their hormone levels first. Anything else? Any questions? Oops, I just lost you guys. Is that it? I don't know why I keep losing you guys. Give me a second. I've lost my... Just keeps blowing up. All right, it looks like that is it. Thank you guys for attending. I appreciate it. Again, you can find it on my website. If you have any questions, please, you can also email me at drlindsay.snelson@gmail.com. And I hope to see you guys next week. Thank you.